Hello, I'm Dr. Adriana Potter. On Benefit Yourself series today, we're going to talk about why sex may hurt. There's several reasons. We're going to go over a bunch of them, and then some of them will be addressed with a pelvic floor physical therapist, and some will be addressed with a combination of the pelvic floor and your gynecologist. Okay? Before we get started, I wanted to explain to you a little bit the pelvic floor muscles so you understand what is the anatomy, and that will make it a little bit easier for you to understand my explanations about why you may be having pain with sex, with sexual penetration. Okay, here it is a pelvic floor model, and what you can see, it combines a bunch of bones and organs and the muscles on the bottom. The sides of the wings are the ilium, and here it is the sacrum, and down here it is your coccyx. Okay, we have a lot of, here will be your hip bones and a lot of hip muscles to hold that hip bone into the socket right in there. Okay, for you to understand a little bit in anatomy, let's go for the external part of it. Right, we have here is missing the skin, but here are your pelvic floor muscles. And if you look a little bit closer, okay, we have here, there will be your labia majora on the top of that, and then right inside here will be your labia minora, okay, the inner part of your genitals. You can see the opening of the rectum and the opening for the vagina, which we call introitus, and that forms the vaginal vault. And they have the urethra right in there for where you pee from, and then we have the clitoris. Okay, here's the pubic bone that many women have issues when they are pregnant. Okay, at least you understand, like pubic pain, pubic symphysis. This is the area that we're talking about. Okay, when you look from the inside, okay, I'm going to tilt the model a little bit and hold my organs. You can see that all the way in the back over there, it would be your colon. And in here, it is your uterus, ovaries on the side, and the bladder on the front. Okay, I'm going to move the uterus so you can see how the pelvic floor surrounds this long part in here is the vaginal vault. That's where the penetration occurs in the area. And inside of that, we have the cervix. So when you are doing a self-examination and you put your finger inside your vagina, if you touch something that feels like the tip of your nose, that's your cervix. Okay, and then here is on the bottom, the back of, sorry, it is your colon. Okay, and you can see that it has a little bit of the kink in there. Okay, I'm gonna put it here for a second. This kink in here, it is actually surrounded by the pelvic floor muscles, and when the muscles relax and you want to poop, and then this kink will gonna get straight, and because the pelvic floor muscles are relaxing, you're able to pass the stool. Okay, so it's very important to remember about this kink, because when it comes to regarding constipation, that's actually one of the areas that, because your muscles may not be relaxing, is because the kink is getting too pull, and then the angle is too small. Okay, and we have the bladder in here. Okay, and that sits right up front. Alrighty, now we can have a little bit of better perspective how the muscles are inside and how they form like a pelvic bowl, and it closes on the bottom and supports all the organs. So it's important for bowel and bladder function, as well as sexual appreciation, and supporting all those areas. Okay, the first reason that I'm going to go over why you may have pain with intercourse with sexual penetration is because of the introitus being too small. Okay, usually a young woman would not know so much about their genitals or anything going inside until they have the first tampon experience. And some women don't even ever have any tampons, they wear the pads. But upon an application of a tampon, a woman may become more aware of the tightness of the introitus, and it may be painful with the applicator or the insertion of the tampon. Similar when the penetration of the penis. However, the penis is much larger than a tampon. So if you're having a very small introitus, never had an intercourse, and you're going in for an intercourse for the first time, that might be one of the reasons you may have pain with that first attempt. Okay, there's ways to address the tightness, and I will go over that in a different video. Today we're going to talk about only the reasons why you may be having pain with intercourse. Okay, another reason that is related to the opening of the introitus is when you have a muscle spasm in the area, or you have a hypertonic pelvic floor muscles. Both of them will decrease the introitus, and upon penetration, insertion of a finger or a penis, it may be painful because the muscles may not be relaxed enough to allow that intercourse to happen. Okay, one way is also may have contributing to the pain is the lack of lubrication. It may be that your body does not produce enough of your natural secretions to allow a sliding in motion. So whenever women that have had already their gynecological exams, they always use the lube to do that examination. So that might be one of the reasons, because your body does not have that, and prior to intercourse it will hurt as well if that's not enough lubrication. Lack of foreplay may be one of the reasons why you're not having enough lubrication. Anticipation of pain may be another reason why you're having that lack of lubrication. And sometimes you may have enough lubrication, but you are anticipating pain because you already had a negative experience with intercourse, a painful attempt to have intercourse. And anticipating that pain makes those muscles tied up on you a little bit more, and it makes it difficult for the insertion of the penis. So that one of the reasons. So it's a combination of things that might be happening. And a pelvic floor physical therapist is pretty good about addressing and kind of asking the right questions to a female to sort out that issue. Okay. So let's go a little bit of the muscles. If you have a hypertonic muscles, the muscle is going to be elevated, tight, and not opening it. And you need to stretch and relax and massage it. And in the videos in the future, we're going to be talking about how to do those things. Okay, but you also may have some hip tightness or some hip issue. We may have some arthritis, a labral tear, or you may have had a subluxation of your hip. People with hypermobility can experience that. And then the hip muscles, which are so close to this rim in here and towards the back, they might spasm on that, and they create a dysfunction in the pelvic area. In a pelvic examination by a pelvic PT, we'll identify that. Are we talking about a pelvic floor muscles, the introitus? Are we talking about any of those levator A9s, which they have a bunch of them? There's about I think 5 or 6 of them. So we need to make sure that we discern about where is your pain. Is your pain towards your hip? Is your pain towards one of the levator A9s? Is your pain over the superficial pelvic floor muscles towards the genitals, the introitus? So you need to address that, and knowing which one it is and how to address it is very individual based. It's not something that, oh, if you have this and then and that. It's very complicated. It takes a trained person to identify that, and we pelvic floor therapists are one of them. Okay, so another reason that you may have issue is that if you're having issues with the bladder, like I mentioned to you, the bladder, right, sits right here on the front. And because of the proximity of the bladder, if you're having a lot of issues like interstitial cystitis, overactive bladder syndrome, or you're not having enough hydration, that may irritate the lining of the bladder, and your pelvic floor muscles is so close to them that it may even kind of overflow that issue from the bladder to the pelvic area. So that needs to be addressed as well, which during examinations with the PT, they will tell you about that. Okay. Another reason that you may also have the pain with intercourse is because you're having chronic constipation or chronic unmanaged IBS. This is our colon, right? So it goes down in here, and then going down. So if you think about it, looking in the front, we have our ascending colon in here, and we have the descending colon that connects to that sigmoid colon and rectum and anus. If you're having a lot of fullness because you're constantly constipated, the colon itself here, this section in here, will get enlarged, and when you're trying to defecate, it may be painful and having issues with the pelvic floor muscles, because remember, the pelvic floor muscle supports that rectum, and upon the fullness and the need to evacuate, the muscles need to relax and you bear down and you easily pass the stool. Well, sometimes it may not come that easily, it may be painful, and that's kind of an insult to your pelvic floor muscles. You have to make sure that you address the constipation side of it too, so you have one less thing contributing to your painful intercourse. Okay. Besides of the hip, we're talking about also sacroiliac dysfunctions. If you're having a lot of mobility into this sacroiliac joint in here, patients with hypermobility or pregnancy express that quite often. These muscles may move a lot, and then when you are having intercourse, your legs are spread and you are doing quite a lot of movement in the area. And if you're having excessive mobility in the area or have instability in the area, your muscles may kind of start guarding and tensing up to try to stabilize the area. So over time, it will create a dysfunction in the pelvic floor muscle, not because the pelvic floor itself, but what's happening to the sacroiliac joint itself. Okay. And then we also have the lumbar section. So a lot of the nerves like L4, L3, L4, L5, and then S1, 2, 3, and 4. All those muscles create the lumbar plexus. And the lumbar plexus run into this area here, and then sciatica coming into the sciatic notch. We have the pudendal nerve, we have the obturator nerve. All those nerves are coming to the pelvic floor muscles. So if you're having irritation or having a bulging disc or having a lot of muscle tension or dysfunction to the disc or a lot of arthritis, that it is irritating the nerve roots of a segment that innervates, that send innervation to a nerve to the pelvic floor, may be contributing to that pain that you're actually having with intercourse. It may not hurt as you're doing it, it may hurt more afterwards. So pain with intercourse is not just pain with penetration, it might be pain afterwards. There's also a couple things about vascular issues. I'll think about it that when a female is approaching intercourse and she's getting foreplay, getting all stimulated, the libido is there, the pelvic floor muscles will engorge, so the blood flow rushes into the area, and then upon reaching the orgasm, there is a constriction of those blood vessels, and the blood will whoosh it out of the pelvic area. Some women may still have the orgasm, but that constriction may not happen and the blood may not kind of get that flow. So we think about blood flowing in prior to intercourse with stimulation, and then blood flowing out after you finish intercourse, you have reached the orgasm. So that blood flow, that vascular portion of it, may be the issue, because not the pelvic floor muscles, but the veins and arteries that are assisting that mechanic happening, that physiology happening to the blood vessels, with the blood going in and out. So if you're having a vascular issue, and the pain is very specific, and usually when that's the case, the pelvic floor physical therapist will do a differential diagnosis. During the evaluation, we kind of sort it out, and then refer you to go see a vascular doctor to rule it out, pelvic floor congestion, because that's something that it goes underdiagnosed for many years, and like pain with sitting, pain with standing, pain after bowel movement, pain after intercourse, all those things. Some of the stuff like, doesn't look like it's a pelvic floor muscles per se, so we're kind of suspecting a little bit of vascular issue. So another reason why a woman may have pain with intercourse, it might be from an injury or insult to the pelvic area. It might be from surgeries or a fall or even a sexual abuse. And each one of them are addressed differently with your physical therapist. It is very important to disclose to your therapist if you had any sort of negative experience with sex in the past, because that will help us to give the proper recommendation about how to treat that and how we address it and how we assess it. We always wanted to know that up front, so it helps us to make sure that we are being a little bit more sensitive to the area when it has been a sexual abuse. Of course, with surgeries, usually after the doctor clears you from getting to go see a pelvic floor therapist, we will be able to assess that correctly and see what it is from our scope that we can treat it. And from a fall, I had several patients that had broken their coccyx because they fell down into the area, or they kind of fell down and the coccyx kind of stayed to that flex position, and then there's a disruption in bowel and bladder and sex as well. So we have to make sure that coccyx is in the proper alignment, because if you look down the bottom, so here is the rectum and the muscles goes right to the coccyx, and here we have some of the ligaments that we also check to make sure that there's some flexibility in there. But you have to make sure that this coccyx is in the right alignment, and if it is too flexed or too extended, it might be one of the reasons why you're having pain with intercourse, and chances are that you're also having pain with sitting and standing. So we kind of identify that during the evaluation. So these ligaments are also some of the areas that we kind of go in and treat, and we make sure that they have enough give into this area, and we address that. So if you're having a lot of tightness because you're being in the pelvic obliquity, that means your pelvis is off alignment, and there's a variety of directions that alignment may go. Those ligaments may kind of harden and become a little bit more fibrotic, and which means there will be less mobility into that sacroiliac joint. So we want to make sure that we identify those things so there is more symmetrical feel on both of those ligaments on the right and left, as well as mobility and the flexibility. So hip flexibility and lumbar flexibility are other things that we assess to make sure that those are not getting in the way of that pelvis mobility. Because think about it now, we're tilting that pelvis quite a lot when we have an intercourse, and there's a lot of movement happening, and if your body is restricted, it may kind of create it over time, that issue. I always tell my patients, usually when it comes to pain, it may be a one-time insult that created that pain, or maybe like a little things that you keep doing and you don't realize that that dysfunction is there, of the pelvis, the hip, or the lumbar, or the pelvic floor muscles, and I keep filling up the cup until the last drop comes in and your body shuts down and says, no, this is not going to happen. Okay, so we have to make sure that we look into the overall picture, not just the pelvic floor muscles, not just the opening of the introitus and the levator ani muscles, but the hip, the pelvis, the sacroiliac, the lumbar section, and even abdominal area. We look at and the organs itself to do those differential diagnosis. So we will look over those things, why the pain it might be present. Okay, and a couple other things that also come to my mind about why you may have pain with intercourse. It might be because, if you had cancer to the colon or to cervix, and you had a surgery, usually there's a surgical portion of it, and then sometimes we'll get chemotherapy and radiation. So with chemotherapy, there is a change into your whole body. Your muscles become a little bit less flexible and wear out more easily, more fragile. Not only, pretty much in your whole body, including your pelvic floor muscles. So we need to make sure that give enough time for healing after that chemotherapy. So you understand that the chemotherapy also changes libido, changes lubrication, changes pliability to the muscles, and then we can kind of help with that part of it into post cancer chemo treatments and help with them. If you had radiation to the area, the radiation would definitely harden the tissue, and it depends how many sessions you have had. It would be more and more fibrotic. So the more sessions you have and more fibrosis it creates into those muscles, and those muscles are supposed to give. They kind of, think about it, it is supposed to kind of open up and allow the sliding and gliding that happens with intercourse. And if you have radiation to the area, the tissue not only become quite fragile, so they kind of tear more easily and you might bleed more easily. So you have to make sure you prevent those things by massaging it and finding out where the restrictions are. And then your doctor usually will kind of clear you out to do it. I would say in terms of radiation, it's important to start working sooner than later. Unfortunately, many of the cases that have come to my care, they have radiation for several sessions, and it has been a year or so, and they are tired that nothing is resolving, nothing's getting better, but then there's a lot of fibrotic tissue, and then we have to work with with more restrictions in trying to restore that pliability, that softness to be present in there. And so if you're able to start sooner than later, it's best. So don't wait to ask your doctor to say, hey, can I start pelvic floor muscles? I'm finding now that I'm having some pain and tightness on my pelvic area, and it may or may not be affecting the bowel and bladder, but if it is, definitely you want to start sooner than later. In the intercourse as well, you don't want to be waiting until too much time has passed, too many fibroses have developed, and the muscle has become less pliable. Hopefully this video clarified several other reasons that you may have the intercourse. So we talked about a small introitus, opening up the vagina. We talked about the decreased pliability. We talked about the pelvis, pelvic alignment, dysfunction of the hip, muscle spasm, hypertonic pelvic floor muscles, which it might be coming from a variety of reasons as well, dysfunction of the lumbar, the disc, chemotherapy, radiation, dysfunction of the bowel and bladder might be affecting to that painful intercourse that you're currently having. So it's not as simple as saying like, oh yeah, just use more lubrication, you're done. I would say that it's more important to really address that with a pelvic floor physical therapist, because the more negative experience you have in attempting the intercourse, the harder it becomes for you to overcome and becoming more relaxed and kind of working into that. I always welcome couples, so I have the husbands come or the partners come, so I discuss with them, this is what's happening to your wife, this is what we're finding it, and I teach them how to work with them, and I always tell like, hey, this is part of foreplay, this is may or may not result in sex, in intercourse, in sexual penetration, and you have to be okay with that, because when she's ready, she will give you the signs that you're ready to have the intercourse. But I like to make that into a journey of more intimacy, not just sexual intimacy, sexual penetration, but sexual intimacy, so the partners can be part of the solution and help the female to achieve that softness that allow the couple to have that positive experience with intercourse again. So I welcome the couples to come and get that learning experience and becoming part of the solution. Okay, so chances are that if you have not seen a gynecologist prior to come and seeing me, I will send you back to see a gynecologist to get that proper examination from them, to rule it out anything regarding your bladder, your uterus, your ovaries, and anything that might be fibroids in there. It might be endometriosis in there, like an infection going on. I need to make sure that is taken care of prior to seeing me. And if that's not, I will send you to a gynae and make sure that that is done. But a pelvic floor physical therapist will address and look into all these reasons why you may be having the pain and sort it out. So it's like a detective work and trying to sort it out, what is the cause for that patient, because it is a combination. The majority of the time it's not only one factor, like you have one thing you address and it boom, it's all great. It is a combination of things that might be causing the pain, and we address as multidisciplinary approach with the gynae and in our sessions. And sometimes vascular doctors will kind of go over into the area to treat and provide you the best care. Hopefully you enjoyed the video today. I'm Dr. Adriana Potter, and on Benefit Yourself series today, we cover the main reasons why you have painful with sex. Don't forget to subscribe and press the bell button so you can get notifications for the future videos. And I will be addressing, showing you how to, some of these things might be addressed with specific techniques that will kind of tell you, okay, what kind of help am I going to get from a physical therapist, okay?